Healing Healthcare Training Institute, Nurse Allen coming to you today with all things CNA. Today we're going to be going over denture care. That is one of the 17 state testable skills here in the state of Michigan. It may be applicable in your state. We're going to be going over all of the supplies that you need for denture care. So just sit back, relax. We're going to go over how to do denture care and the supplies that you need. Here are some of the supplies that you need for doing denture care. In this particular skill, they're going to read in the scenario. In that scenario, they're going to read, please brush the resident's dentures. There's going to be a live actor. The patient will be in the bed. They're going to sit up. They're going to be in their room. And you're going to do the denture care, and you're not going to put the dentures in their mouth. So what you have to do is just get your supplies together. Now, when you're getting your supplies, again, you can put a barrier on the table or a paper towel barrier, or you can use a bath towel. You need to have a barrier on their table. But this skill can be done at the sink. I just wanted to show you all the supplies that you need when you're doing this skill. So what do we need for denture care? We need a set of gloves. We need toothpaste. We need a denture toothbrush. Okay. Now, depending on where you go test at, because I've went to a place where I seen them using toothbrushes for their denture brush. But you should be using a denture toothbrush, but it's okay if they use a regular toothbrush, the disposable ones, that's fine. But just make sure you know the difference with the regular toothbrush. The denture toothbrush has the front bristles, and then you have the side that brushes under the undercarriage of their teeth and to get all the gum line and all of the debris from up under the adhesive, up under their palate of the dentures. Okay? So once you get all your supplies, then you can do your denture care. Now that we have our supplies together, now we can come to the sink and do our denture care. So the first thing you're going to do is line your sink. When you line the sink, you can line the sink with a paper towel. That's one of the things that you can use. You can also use a face towel, or you can use a bath towel. In real life, you would use a bath towel, but for state testing purposes, you're going to use a paper towel, or you can use a towel. You want to have something in the sink, and it's going to look something like this. I'm trying to have you to see everything the way I'm doing it. So when you're doing that at the sink, you're going to turn the water on. Mind you, I've already put my paper in the sink. I'm going to turn my water on with paper towel. I'm going to discard that into the trash. I'm going to take the water off of the dentures. Okay, you see it has a little strainer. You're going to set the dentures in the cup. I rinse this out once. I rinse it out twice. I rinse it out 3 times, and I leave cool tepid water, and I have my barrier here already set. Now I'm going to take my toothbrush and let it get wet, and I'm going to apply a pea size to each side, a pea size to the front and a pea size to the back. Okay. Now I'm going to take the dentures and I'm going to brush each surface. So I'm just going to show you. I'm going to brush the front surface of the teeth, the front surfaces of the teeth, the chewing surfaces of the teeth, and the behind the teeth. Then I'm going to turn them over, and I'm going to use the back of the denture brush, and I'm going to brush all of the surfaces in the inside. Once I do that, I'm going to rinse it. Rinse those dentures. Put my little strainer. Put that in there. I already got my cool tepid water. I already have my barrier set. I'm going to take a paper towel, turn the water off. Then I'm going to take this one out of the sink. Then I'm going to take those dentures over. So I'm going to grab another paper towel. I already have one on the bottom. I'm going to take another one and I'm going to take it back to the patient's bedside. So the first thing I'm going to do is take my dentures and put the dentures away. Put them back at the bedside. And then I'm going to go put away my supplies. So I'm going to put away the supplies. I'm going to throw my paper towel away. I'm going to again pinch in the middle of my gloves. This skill says that I can hand hygiene. So at the end of the skill, I'm going to hand hygiene, and I'm going to think about the steps of my skill. I knocked on the patient's door. I announced myself. I let the patient know what I was doing. I gave her privacy so no one knew what I was doing. I did all of those things in the beginning. The last thing that I would check to just make sure, because this is going to be on a live person, I would just make sure that that person is okay. So I would ask her, are you okay? Do you need anything? Perhaps a magazine or some water or anything? They're going to tell you they don't need anything. At that time, I'm going to triple check again. Even though it's a skill and it seems very simple, the things that they're asking, did you put all your supplies away? Did you brush all surfaces of those dentures? I did all of that. After I'm confident about I did everything, I can then tell my proctor my skill is complete. Thank you. Click like, subscribe, and share. I will be sharing different bits of videos. They may be applicable in your state. Thank you and have a nice day.